One of the good guys, Dr. Michael Lim. He's a cardiologist with SLU Care and SSM SLU Hospital. He's here every Wednesday about this time. Good morning, Dr. Michael Lim.
Oh.
There you go.
Good morning.
All right, so not that this is a This Is Us episode, but it sort of inspired us to talk about heart attacks and the proverbial Widowmaker. And it got us to talking, what's the difference? Some people have 4, 5, 6 heart attacks. Other people have 1. And it's tragic. So explain to us the difference and what's going on here.
Yeah, so apparently on there was a show after the Super Bowl on Sunday.
Yeah, it's a great show.
A lot of people watch it, and they found out that one of the main characters died of a so-called Widowmaker.
Right.
So, yes, a heart attack is really pretty simple. You have a blockage of some degree. It could be 5%, 10%, 50%, 90% within an artery that supplies blood to the heart.
Okay.
And for whatever reason, that blockage ruptures. And so we call the blockage a plaque. And when that ruptures, it's a ruptured plaque. And when that plaque ruptures...
You mean like breaks off from inside the
no,
vein?
like ruptures in terms of the wall all of a sudden breaks down and ruptures.
Okay. And
so the plaque is composed of cholesterol. And cholesterol and blood, when those mix together, they form a big old blood clot. And so that basically stops the blood flow going down that artery to that part of the heart instantly. And it's that lack of blood flow and that sudden lack of blood flow that causes the symptoms of a heart attack and the potential repercussions of the heart attack. The long-term repercussions of a heart attack is if the heart muscle doesn't get enough blood flow, the heart muscle dies. Depending on where that plaque ruptures is sort of the makeup of how severe that heart attack is. So the Widowmaker itself is a moniker that's been given to a plaque that ruptures in a very early portion or a front portion of an artery we call the left anterior descending coronary artery. That's a main artery that goes down the left side and the front side of the heart. And it supplies the vast majority of the heart with blood. And so when you lose that much blood supply to the heart really reacts poorly to that. It goes into a bad heart rhythm called ventricular tachycardia most frequently. That degenerates quickly into ventricular fibrillation, which is just kind of shaking and shivering. And that's not good enough to supply blood to the rest of the body. And so that could potentially lead to passing on.
Do people survive this Widowmaker?
Can be survived, absolutely. And in fact, the last person I saw at our hospital with a blockage in this point, fortunately, is still walking around today. We were able to be fortunate enough to do that. But some people don't survive other ones that aren't technically Widowmakers.
Right.
And so heart attacks are still problematic. The good news is at this point in time, there's about a 2 or 3% chance of not surviving a heart attack.
Really? That low?
Yeah, it's as low as it's ever been.
Wow.
Cardiogenic shock, though, or a cardiac arrest is a little bit higher of a bar. And so that's only 1 in 2 chance of surviving that event. And so if the heart attack is so bad and so full-blown that it actually causes these heart rhythms to exist and the heart to just kind of sit there and shiver, now your chances of survival are only 1 in 2. And so that's an area that we're trying to actively get after and take care of and see whether we can actually improve.
Explain the difference between a heart attack and a cardiac arrest.
Cardiac arrest can be caused by a heart attack. And so, like the person in the TV show, the plaque ruptures, the heart starts to shiver, they try to do compressions and resuscitate the patient. That's cardiac arrest caused by a heart attack. But a cardiac arrest can be caused by other things. This heart rhythm that I talked about, ventricular tachycardia, this can happen spontaneously and without a heart attack, cause a cardiac arrest. And of course, through the years, we can recall public figures, especially in the entertainment business, where the initial line with respect to their needing to go to the hospital is they suffered a cardiac arrest, which is so there's a more lay term where if somebody collapses suddenly, we call it a cardiac arrest. It not necessarily primarily heart related, but
Right.
it gets called a lot.
So my father had a heart attack, and I was with him, and we were walking in a golf tournament, and he was like, I'm exhausted. I'm gonna call a cart. He got a cart. He met us there and spent the rest of the day at the golf tournament. And then we got a cart. And on the way home, he's like, I really don't feel good. I should go to the hospital. He goes to the hospital, and they said he had a heart attack. And then he had triple bypass surgery like a day later.
Crazy, huh?
Explain that. What was that? I mean, that happens, I guess, quite often?
It does. And this is the concept I think you set up as we started this conversation. Like sometimes it's a snap of the fingers and somebody's gone.
Right.
And other times it seems like it can be a lot more prolonged in terms of its time course. When we get a situation like your father, man, I don't think it's worthwhile to ever stop and say thank you. And thank goodness.
Right.
The gods were smiling on us,
Yeah.
and it's great to be lucky and fortunate.
I have another question.
Go ahead.
A friend of mine whose father died of a heart attack, we were pretty young in high school, and he just recently died of a heart attack, and he was really young too. Is there a correlation between someone's family member who dies of one and then that person getting one too?
So there's absolutely a correlation. Genes or a genetic predisposition absolutely is one of the biggest risk factors for inheriting heart disease, inheriting the predisposition to form these plaques and potentially have them rupture and have heart attacks early in life. We don't end up focusing too much on that. What we want people to do is recognize, when you look at your family tree and you say, and patients come in and tell me this, it's like, look, nobody in my family's lived beyond 64. So I'm 62 years old. Nobody's lived beyond 64. It's like, okay, that's genes, right? So can we beat that? Well, yes, we can. But yes, it's going to take work. What do we focus on? Well, we don't focus on the genes because we can't change them.
Right.
So we focus on the things we can change.
Mm-hmm.
So our medications appropriate, our tests and other things appropriate, our lifestyle changes appropriate. Look at your blood pressure, look at your cholesterol numbers, make sure if you're diabetic that we're taking care of that. If you don't know you're diabetic, let's figure that out. Focus on those things.
What's bypass surgery? I know that's a relatively new in the last 20 years or so. It used to be. Now it's sort of routine, it sounds like.
So bypass surgery's been around more like 70 years.
70 years?
Yeah.
Oh,
And
sorry.
That's okay. But it's still a relatively new treatment. I mean, we're still relatively new in trying to figure out a lot of these things. Bypass surgery, in some ways, is a rudimentary treatment, but in some ways is the standard of care. So it sort of runs both spectrums. And what you do in bypass surgery is it's open heart surgery, and you have predetermined where potential blockages are in the coronary artery. And then you identify places beyond those blockages, and you sew a bypass graft from the aorta or another blood vessel down, around and past where that blockage is, so that blood flow has a different way to get to the heart and doesn't have to traverse the blockage.
So kind of like taking the side streets around the traffic accident.
Absolutely. But what you do then is where that traffic accident is, man, you just leave that road closed. And the side streets become the main streets. And this has been a life-saving procedure, definitely for the past 25 years. The part of the life-saving procedure of bypass is to use a graft called the left internal mammary artery. It's an artery that comes down the front of your chest wall. If that artery is taken down from the chest wall and deposited onto the heart as a bypass graft to this left anterior descending coronary artery, that looks like it stays open in most people for more than 20 years and provides life-prolonging therapy. Life-prolonging therapy.
It's really good stuff today.
Wow.
Dr. Michael Lim, he's a cardiologist with SLU Care and SSM Health SLU Hospital. That is an education. That's almost worthy of like a half a credit point at SLU Hospital.
think it is.
Everybody gets half a credit point.
That was really good stuff.
I mean, that you guys could send your checks for that half a credit point.
on
You figure out where you want to donate it
I'm
to.
on scholarship, so don't worry about it. Dr. Michael Lim, cardiologist, SLU Care and SSM SLU Hospital. Good stuff today. Thanks for coming in.